Today we'll be looking at the accidental swallowing of camphor or naphthalene balls in children. Camphor or naphthalene balls are very toxic to the human body when swallowed, inhaled, or even when it makes contact with the skin. The worst of its toxicity is experienced when it is accidentally swallowed. It's important that we note that the best thing to do when it comes to camphor or naphthalene poisoning in children is to prevent this from happening. And how do we prevent camphor or naphthalene poisoning from happening? Number one, ensure it is properly stored away from the reach of children. Number two, ensure that areas where these naphthalene balls are found within the homes are properly secured in such a way that children do not easily gain access to that vicinity. Never leave a child unsupervised within vicinities where naphthalene or camphor balls are present. In the event that camphor or naphthalene balls has been accidentally swallowed by a child, what are the things you might see the child experience? It could be abdominal pain. The child can become restless and start crying more, can experience vomiting, can experience seizures. Next, the child can suddenly have reduced activity. So you see a child who prior to the accidental ingestion of camphor or naphthalene ball was active, playing around, jumping around. Suddenly, the child is no longer that active, feeling slow. What are some of the actions that we should not indulge in when we discover a child have accidentally swallowed camphor or naphthalene balls? Number one, do not try to force the child to throw up. When you try to induce vomiting, the risk of substances within the stomach and the esophagus entering the lungs is high. That's what we refer to as aspiration. So please do not try to induce vomiting in the child. Do not give palm oil, it has no benefit. Do not give milk, do not give raw egg or ipecac syrup. These have been found not to have benefits in situations like this. Instead, they might prolong the stay of this substance within the body. So the best line of action to take is to quickly take the child to the hospital. The child might not have symptoms. Okay, so that there are no symptoms does not mean you should not take the child to the hospital. Do not sit at home waiting to see if anything will happen before you take the child to the hospital. Early presentation at the hospital will help increase the chances of survival of the child.